A busy day at the state capitol as the people in charge of filling your prescriptions come face to face with lawmakers. Thanks for joining us. I'm Rolly Hoyt.
And I'm Faith Woodard. It was a packed house at today's Legislative Council meeting where pharmacists made their case for an emergency rule that would help them deal with pharmacy benefit managers and the costs that come with them.
TV11's Rebecca Brown attended this crowded meeting and explains what just happened. Rebecca?
Rolly, Faith, the debate of pharmacy benefit managers is nothing new for Arkansas lawmakers. In fact, they've already passed a law to address the issue. But this new rule is their way of dealing with the thousands of complaints they've received about PBMs, and they hope it will force them to lower prescription drug costs and increase patient access.
Because if this doesn't work out, I've got to go get a job somewhere.
In front of a room full of lawmakers, 3 pharmacists from different parts of the state shared the emotional testimonies of their businesses spiraling all because of 3 words. Pharmacy benefit managers. It's been a highly debated topic for years, creating a back and forth between those in white coats and lawmakers. But on Thursday afternoon, the AOC subcommittee met at the Capitol and approved Emergency Rule 128 in an effort to hold PBMs more accountable.
They're the fox guarding the hen house, and they will charge as much as $19,000 for a cancer drug that would be $100 at a small pharmacy in Stuttgart.
The emergency ruling is a reaction to the thousands of complaints the insurance department receives from pharmacists not being able to survive the costs that come with PBMs. While there is already an Arkansas law requiring managers to pay pharmacies the national average, lawmakers at Thursday's meeting admitted that more enforcement is needed.
If we don't enforce this law, I think we're going to see significant changes in this sector, and not for the good.
I agree.
But with every meeting comes a debate. Some legislators brought up a concern about approving the new rule, saying that healthcare prices could go up. That can make it even harder for the average person to get the drugs they need. But the group presenting says while that is a possibility, research shows that hasn't happened, but it's a small price to pay to keep pharmacies in business.
Tell the people who have already experienced health care costs for their insurance out of the roof, increased several years in a row, going to have an increase this year more than likely, that we're going to go up 3 to 4% on them.
We don't want to have those same health plans of your constituents not being able to go to their independent pharmacy in their hometown and have to travel long distances as we lose pharmacies.
With this new rule comes new hope for pharmacies across the state as lawmakers work to ensure they stay open and providing needed medications for Arkansans.
This is the first time in my career where every pharmacist in those practice settings are lockstep in agreement that this is needed to enforce our existing laws to protect our patients.
There was also a motion approved that requires the insurance department, who is responsible for handling PBMs, to report to Legislative Council on a monthly basis. Those start next month. For more details, you can visit our website at THV11.com.